Thanks, Pele. Thanks so much, and welcome everyone that's joined us today. I think we can go to the next slide. Please do fill out the poll, and it helps us to understand who's on and why. So by all means, do that. I'm Kwesi Rollins, Senior Vice President for Leadership and Engagement at the Institute for Educational Leadership, and IEL is a national nonprofit that for over 60 years has been devoted to changing and transforming systems through people, cultivating leadership capacity across all levels. We've been in deep partnership with Attendance Works and Hetty Chang, who's our illustrious leader, executive director. You can go to the next two slides, really. For quite some time, next slide. Attendance Works, of course, by now you know, is really the preeminent voice around chronic absenteeism and really help to get this movement off the ground in the most important ways, advancing better policy, practice, and just bringing people together around this issue. Next slide. We've got a great agenda. We've got 3 dynamic superintendents. And we would thank them in advance because being a superintendent is hard work, and so there's no such thing as spare time. So we really appreciate them taking time out of their busy lives and schedules to join us today and share some of their experience, strength, and hope around this issue. Next slide. Thanks to our convening partners for our attendance awareness campaign this year. You can see the icons, the campaign for grade level reading, Everyone Graduates, Future Ed, National League of Cities, United Way, Mentor Inc., Healthy Schools campaign, and of course, IEL and Attendance Works. Next slide. And we have some new collaborating partners, the Education Commission of the States, Knowledge to Power Catalysts, and Proving Ground. And so welcome to them. The more the merrier in terms of collaboration on this important issue. Next slide, Pele. Our slogan for this year, be present, be powerful. This is a great slogan for all of us anyway. We've got to be present and we've got to be powerful. And so that works across the board. Next slide. So this is the last webinar in our series. You can go back and see the other webinars. You see they're listed here, and we don't yet have the schedule for next year's series. So this is the 4th in the series and focused on leadership for sustainability, superintendents making a difference. Next slide. Key messages. Again, our theme, be present, be powerful. We've got to ensure that students get to schools the opportunities they need to progress academically. Building trust is always an important piece. Trusting relationships promote belonging. Supporting the health and well-being of students, families, school staff improves attendance. And all hands on deck is critically important. And we'll hear examples today of what all hands on deck looks like in some of the districts that we'll hear from. Next message. Next slide. Thanks to our corporate sponsors for this webinar, Kaiser Permanente, Scholastic, and School Technology Associates. And you can find out much more information on all of our partners on the Attendance Works website, and we'll send that to you later today. Next slide, Pele. And donate. Attendance Works because we have corporate funders, we've got foundation funders, but it also works with individual donations. Donate today, become a monthly sustainer. I'm one. To some of you, it may sound ridiculous to support a nonprofit that's doing work that it should be doing, but support helps. That's how we get the word out. That's how we make a difference. It's one of the many ways. So for the price of a Starbucks special fancy latte, you can be supporting this important work. Next slide. And with that, I'm going to turn it over to Hetty Chang, our executive director, to begin defining terms. Thanks, Hetty.
Great. Thank you so much. What a privilege and a pleasure to be here with my colleague, Kwesi, and with our superintendents and with Derek Feldman, who will be giving us some of the latest and greatest about what we're learning about attendance post-pandemic. I want to start by leveling the playing field a little bit. Make sure that folks, because sometimes we're getting new people on these webinars, know terms. There's average daily attendance, which typically talks about how many kids show up each day. Tends to tell you things like, the day after Halloween, we better make it super engaging. Or the days when we have snow days, if kids aren't prepared, they're actually having challenges. So it's a helpful, but actually masks levels of chronic absence. There's truancy, which only looks at unexcused absences, tends to emphasize a compliance approach, and tends to end up with kids ending up in the legal system. So a bit more blaming punitive approaches. And what we have been trying to really look at is chronic absence, missing 10% for any reason, excused, unexcused suspensions. We want to talk about the impact of those days and the benefits of being present, taking a preventive, problem-solving, trauma-sensitive approach, because we know often that when kids have had trauma, they actually are have challenges getting to school. And the worst thing we can do at that moment is say, what's wrong with you? What we need to say is, what happened and how can I help you? So we can cultivate that family and student engagement, which we'll be hearing about more. That is so crucial. So these are terms that are different, but they also have a bit of different connotations on how we operate. And both truancy and average daily attendance have masked high levels of chronic absence. And if you go to the next slide, what we know right now is that showing up to school matters tremendously. It matters for academic reasons. It also matters for kids' social emotional development. Next slide. And chronic absence nearly doubled during the pandemic, going up to as high as almost 30%. We saw from 22-23 data, we don't have national data out yet, but we have state data that shows it decreased maybe a couple percentage points. If you go to the next slide, we are starting to see data from states for the 23-24 school year. And so if you look at this, you can see that chronic absence, again, nearly doubled. That's the red. It started to come down. That's the orange. It's coming down a little bit more, but it's still much higher than what we saw pre-pandemic. Next slide. And this is why we partnered with AEI and Education Trust to launch a call to cut chronic absenteeism by 50%. Actually, Superintendent Anderson was there in DC when we launched that call. And why we want to do this is we don't want chronic absence to be the new norm. We have to say we can not only get back to what we were before, but even do better. This is so important because while this may seem aspirational, we know it's plausible. We're seeing districts, including the ones here, that are being able to achieve this. We're seeing some states starting to show real evidence that they can get down to 50%. This is a clear target. You can adapt it to whatever context you are, whatever level you were at and you increased, you can start to work on this. It's trackable and accountable, especially now that chronic absence data is available in most state websites. And when we make it public, we can create that kind of comprehensive, all hands on deck effort that we know is needed to get these numbers to where we need them to be. And this is, though, about commitment over time. As you can see, the numbers are only decreasing incrementally. And that's showing how long it's going to take us. But with perseverance, with persistence, we can do it. Engaging kids, understanding their challenges, but it's not something that gets solved overnight. Next slide. So it's not solved overnight in part because I was on a call with a reporter this morning and she said, "Isn't there a silver bullet?" I said, "No, there's not a silver bullet. This is not a silver bullet situation. The key to reducing chronic absence is we got to find out and address what causes kids to miss too much school. And what that is can vary a little bit by kid and by community, though it's helpful to see the buckets and understand there are sometimes patterns that allow us to come up with programmatic solutions. It can be barriers. It can be aversion, things like anxiety. It can be disengagement, the relationships that were broke during the pandemic. It can be misconceptions. Oh, I don't need to show up to school anymore because I can just catch up online. When in fact, that's not true for the deeper kind of engagement and the relationship building, or not realizing how much that you don't actually have to stay home for any symptom of illness because we got so good at messaging, stay home during the pandemic, and unlearning that message is taking a bit of work. So the key, though, is finding out and addressing. And if you go to the next slide, it's understanding that when we see high levels, it could be the fact that these positive conditions for learning got eroded and need to be put back in place, making sure that schools feel physically, emotionally healthy and safe, a place where you get belonging, connection, support, academic challenge, engagement. And we're investing in the adults and students in those schools so that they can have the relationships that are so essential. Next slide. This is about putting in place a multi-tiered system of support that can be tailored. Exactly what's in it can be tailored to your own realities and what you know motivates folks and what you know are barriers. And it's built on top of a foundation of positive conditions for learning, because you can't message that kids need to be there unless school's a place where kids want to be. Next slide. This is not a sole person endeavor. This is about mobilizing the entire school community, all of the school staff, students and families, and engaging external partners, because sometimes the barriers and challenges are beyond what schools alone can address. Next slide. And when we know what the challenges are, we can get better at thinking about who are the partners we need to really have in place to address those challenges and make the case for why they need to be partnering with us to be in schools. Next slide. This is about taking a year-long approach where we're starting by creating community in the fall. That's what we're doing now. Nurturing, and then we'll go, when we get to the summer, we'll be engaging in building bridges. Then we'll be ensuring, well, so it's fall, sorry, there's a little challenges. Fall, create community, then ensure support, nurture belonging, and then engage in building bridges. Let's keep going to the next slide. This is really about having these key ingredients for improving attendance, which starts with actionable data to then evoke positive engagement, engage in strategic partnerships, make sure we know who needs more support. And we're actually, some of you might be familiar with this, shifting from talking about it as shared accountability to shared responsibility. And all of the materials on our website are getting shifted to talk about this as shared responsibility. So we see this as something that we all need to contribute to, and then build capacity to do all of this. And this is going to be part of our conversation. I also am really excited, if we go to the next slide, to introduce Derek Feldman, because that positive messaging and how we engage in positive messaging post-pandemic is something we really need to understand. So Derek, welcome. Derek is a managing director with the Ad Council Research Institute. Can you start off by telling us a little bit about why you started to create this research, and then tell us about what it is?
Sure, absolutely. Thanks so much. And I'm glad to be here with you all. And thank you for allowing me to share a little bit of the work that we've been doing, obviously with our friends at Attendance Works and also the Overdeck Foundation. So we began this research initiative, and you'll see this on the next slide, called Back to School, in a way to really look at how can we here at the Ad Council help anybody who's interested in communicating to parents the reasons why obviously children need to be in school, but to also curb and overcome this chronic absenteeism. This actually isn't an area that's new to us. We worked on a similar campaign here at the Ad Council prior to COVID and the pandemic. And that was in New York City schools, where we developed a lot of research and insights and developed a campaign out of that. And it was interesting, and you'll see this on the next slide, where I'll talk a little bit further about our history related to this, is that as we were embarking upon our work in New York City in the 2017 to 2019 area, much of that message, based upon our research, was focused on academic loss. That was really, almost 10 years ago now. And this was to look at, does that message still work post-pandemic? What are we learning about? And if we were going to communicate out, what specifically could we be doing to enhance that message going forward? So what we did is that we created message frames and message constructions, right? That's what we say here at the Ad Council. And what that means is different ways to approach talking to parents about the importance of attendance. We created frames, which is really looking at that mindset shift, the reason or the value proposition. Hetty said a wonderful thing, is encouraging students to be there, but also they're excited to be there too as well. And then storylines and call to actions. All of these were developed with the mindset of trying to understand how can we persuade and engage our parents in a dialogue about attendance. There were 2 phases of research, both qualitative and quantitative, and we just wrapped that actually in August. So this is brand new data for you all. We had more than 5,000 parents who participated in our studies over the course of these different environments of research. And how we do this here at the Ad Council is we create the first set of messaging, and then we allow our participants at every stage to refine it and make it better time over time as well. So what's exciting about that is that that provides an opportunity not for us to communicate to our audience, but our audiences and our parents helping us to create the message, which is really, really key. On the next slide, I'll give you some of the areas of what we discovered. Specifically in this study, what we learned is that a lot of the messaging that we were testing that focused on sort of the consequence narrative. Remember our time right before the pandemic that we did a campaign on? That message really did not resonate anymore. Parents were telling us consistently that, while they view school as very valuable, they place value in many different areas other than just academics. It was more than that. It was about the holistic environments in which children are learning, the peer, the social, the emotional environments of academic and success and performance that they're getting, in addition to what they're learning, actually learning. And so when we focused on academic loss in our messages, parents were saying, well, I think that's important, but there's actually way more other things that are more valuable that I find in school, broadly speaking. And they really didn't like that negative tone. They really liked a more positive tone of not the consequence, but what's the reason, what's the exciting, what's the opportunity for my children to be there as well. In addition is that communication about opportunities is also about maybe what they might be missing out on, that fear of missing out, the opportunity that their children may not get those wonderful academic, social, emotional, and peer learning experiences this week if they don't attend. And we also learned that every time we told specific requirements around things, right? Like try to go every single day, parents would push back a little bit and say, I'm trying. I just am not able to do every day, but I do believe children should be in school every day, which was a very good thing, obviously attitudinally as well. And as part of that message testing and recommendations, we came away saying that what we need to do is reframe and focus largely on the reasons why children should be in school, the value of school. Should we continue to talk about things like how many days they're missing? 100%. Because our job in this study was not to determine if an intervention, a letter home, a visit home, calls to parents, whether that is good or bad, because all tools are needed in our toolbox to make this possible. It's more about how do we frame the larger reason for parents to ensure that their children are in school? And that goes back to the value proposition. Now, we need all kinds of interventions to make it work, telling parents how many and keeping them top of mind about the absences that are currently happening. But in addition to that, we also need to communicate the value of school and reinforcing that through our messaging. While at the same time, it's okay to say, missing 2 days is a little bit too much. But why is it too much? Because they're missing out on things that are more than just academics. They're missing out on unique opportunities, the valuable things that you find valuable, parents, today as well.
Derek,
Now,
can I stop you just for a
go
second
ahead.
and ask a couple clarifying questions? Because we get this sometimes, and people sometimes want very simple answers. So maybe this is it. So when you say that we should focus on the opportunities, you're saying that we can still talk about the consequences, but you're doing both. Can you just clarify? Or are you saying don't talk about the consequences?
No, it's an absolute both. It's an and, not an or. And I think that that's a little challenging for some of us, maybe not in the messaging world, but we do this a lot in all communications. We want to always talk about the features and benefits of something valuable. Whether that I'm trying to encourage Americans to go get a flu vaccine, or I'm trying to encourage them to attend school. What we try to do is encourage and talk about opportunities and the benefits. But it is okay completely to also communicate what will happen if you don't engage as well. And so it is not an or, it's more of an and. What we are saying is the broader narrative to parents should be about the value of school and why that's very important, and reinforcing what happens when they're not there. What are they potentially losing, which is the holistic value benefits that they find too as well. You can do both. It isn't an or an and, or it's not an or, it's really an and.
That's really helpful. And I think it makes me wonder, Derek, if one of the issues is that, families, I've talked to families where they talk about how they saw their kids lose out on social emotional skills because they weren't around other kids for like 2 years. And they're like, oh my God, my kid needs to, or the kid who was at a pivotal time when those social emotional skills were developing, they're really worried about them. And it might be that also that part is top of mind. In
Yeah,
addition, though, what I'm hearing from you to talking about academic consequences. And
exactly.
this issue, I know you said it, but we hear it a lot. We still can say, because became a mantra after the work in New York City, missing 2 days can be a month can be too much. 2 days or more, that's still something you say, but you have to put it in context. Can you just reinforce again, what are you saying about when we give that specific number of days?
Yeah, I would highly encourage using something similar to that, but I wouldn't lead with that. And there's a different way that you can say it, Hetty, that I think we need to consider. It's one way to say is 2 days are too much in a negative narrative. And this is what we do at the Ad Council, right? Or it's another way to say even missing 2 days means they're missing out on some unique things. Notice how I shifted that tone. So I think what we have to decouple here is what the consequential narrative in numerical and so much, and talk about what they're missing out when they miss out even on 2 days, what that really, really means, right? So we use a lot of that narrative when we talk about even working in the health space. When we're trying to communicate with people in America to understand why they should go do something or get a screen and so forth, and saying, if you don't do this, like this is what could possibly, but look at what you'll be knowing, you'll know that what your health program is, and you'll know going forward. We focus on the opportunities rather than just chastising the negative.
Thank you.
Yeah. Well, I just want to mention before I depart that on the next slide shows what we have in a toolkit. If some of you have not had a chance to download that yet, in there, you're going to see some messaging principles. And for many of you, you might be wondering, I wonder what messages they tested. Don't worry, we have it all in there. So we have all the ones that we tested along the way at every phase, and you can see how parents reacted to them and what we changed and modified based upon their responses. So that will be something you want to take a look at. And who are our trusted messengers? Teachers were obviously high on that list. The principals and so forth were in there too. But there's some other unique messengers as well in the community that could play a role. So you can download the toolkit, the research and executive summary if you don't have time to read it all. But I would head to the toolkit for sure. It's a great how-to piece.
Great. I'm just noticing, I think we have a couple minutes with you, Derek. If I'm right about our timing here. One person talks about the importance of not using preloaded attendance letters in data systems, which they find are often incredibly punitive and written way over parents' heads. Can you speak to how people might be able to use what you've developed or even other resources to think about how do you maybe change something that's now a stock part of the system that gets issued every time a kid misses school?
Yeah, so one of the pieces that we often talk about here is how do you want to show up in that last mile of communication? That's always something I ponder, right? How do we want to leave people with when we're trying to communicate? And yeah, those are it's nicely done and it's easy to do, but I would obviously want to reframe what that copy is that's populated in there, which most of the time you can. And if you can't, here's also a time to say, why don't look at how you can forward something to provide some context to it, to say, here's what you might get as a standard. Let me help and follow up with you. Preempt it too, talking to parents to say, you might be hearing and seeing these throughout the school year, but no, it's more about what they might be missing out on. What are the opportunities for them to be in school? So preempt it and establish the context rather than allowing that mechanism to establish it for you.
Derek, there's one last question, and then I think we'll close on this one. But this is talking about the number of school closing lockdowns that have happened, especially after the school shooting in Georgia. So how do we address things like the fears of sending kids to school and what do we know anything about the messaging that addresses that? I don't know whether you've done other things at the Ad Council that address that, but this is a real issue and challenge people are facing.
Yeah, here at the Ad Council, we work on many projects, including myself and my colleagues, Colleen and others at the Ad Council Research Institute, as well as the Ad Council, including our 988 work, our work in extreme risk protection orders, gun safety access, and so forth. And we'll say two things that I'm going to bridge many of our other work with this, is it's all about the messenger and what you're offering to help in this time. And specifically in this study, we actually found like mental health professionals, counselors and others, we're trusted messengers, Hetty. So that's a really good opportunity in moments like this to lean in, offer support and help, at the same time encouraging that engagement and the time, of course, whether it be in school or not, to have dialogue about these situations. It's one of the things that we often find in a lot of our work, it's being communicative with resources and time, helping them understand. And that time can be formal time together in school, or it could be time outside of school to discuss.
Thank you. And I also think this may be a time where having trusted relationships with your teachers, with everyone else, becomes even more important, because when you're fearful, one of the best sources of, countering that is knowing that there are people you care about and trust and who care about you in the school where you're going, whether that's other kids or whether that's teachers.
Yeah.
Thank you, Derek, for all this work. If people have further questions, you can ask them in the Q&A, and Derek, maybe you can, Derek's actually going to stay on to the end so that he'll still be part of the Q&A at the end. But right now we're actually going to be shifting over to our superintendent. So if we go to the next slide, I just want to bring up this key ingredients for change again, because this is why we are so thrilled to have our three superintendents here, because what we know is your work is what enables a district to have these kinds of key ingredients in place and make sure that this work can be sustained over time, so we can really get the reductions, but even stay low, because attendance is one of those things, when you take your eye off the ball, it starts getting worse again. And keeping the eye on the ball is so important, because superintendents are absolutely pivotal. Next slide. So this is my pleasure to introduce our three superintendents. We have Dr. Tiffany Anderson, who is from the Topeka Public Schools. Tiffany Anderson, actually, as you'll hear, she is so inspirational in the ways that she thinks about community partnerships. She thinks about wraparound services and supports. Tiffany, thank you for joining us today.
Thank you for having me.
And then we will have Dr. Angela Chapman, Superintendent, CEO of the Columbus City Schools. I had the pleasure of connecting to Dr. Chapman, actually, I think even maybe before she got to Columbus, but then when she was Columbus, and she was the chief academic officer, who then took this vision and made sure that attendance became integrated in all, because it wasn't before she was the superintendent, into the school district, and integrated with other existing initiatives so it could be lasting and sustained. And then our last superintendent is Andreas Zamora with Livingston Union School District. And I was remiss in saying these are also three very different kinds of districts. Tiffany Anderson is out in the middle of our country's fairly small district, suburban, urban kind of situation. Dr. Chapman is in Columbus City, which is a huge school district, lots of pretty challenging situations with poverty. All of you guys actually have a lot of low-income kids. And then Superintendent Zamora, who I've had the pleasure of also going and hanging out in his school district, small little 3,000 rural district, also has challenges with families facing poverty, but really amazing long-time community where people know each other. And it's really helpful to hear the strategies across our three superintendents. Now, with that, we're going to actually ask each superintendent to give us a bit of an overview about their district, what they're seeing in terms of reductions in chronic absence, and what are their very top strategies. We're going to start with with Andreas, I believe. Yeah. Let's go to the next slide. We're going to go little to big. That's going to be the order. So,
well, thank you, Hattie. Good afternoon, everyone, and thank you for the opportunity to talk about Livingston on this important topic. Livingston is located in California, Central Valley. We're in the Egg Belt of California. We serve an amazing community of hardworking families. A lot of our families, parents work in fields or in foster farms, a big factory in the area, or Gallo wineries. We serve about a little over 2,500 students, 3 elementaries and a middle school. About 69% of our students are qualified for free and reduced lunch. We have a very diverse community in terms of languages and cultures. 83% of our students are Latino, and our other larger population is our Asian students, East Indian, Punjabi families that we serve. Next slide. So for us, attendance has always been a key piece in terms of how we help our students succeed. And generally, we've had good attendance overall. Chronic absenteeism, like all of us, we know, escalated, and it is a challenge. It continues to be a challenge. We did see a decline this last year of about 4.86% from the prior year. And our longer term goal is looking at 8% or less. Overall attendance, we're looking at 97%, and we're at 95 currently. So we're moving in the right direction. For us, key strategies have been 3 if I had to categorize them. The first one is consistent messaging and focus. And that starts for us with frankly, the superintendent and the leaders of the district. And that messaging has to resonate in the classroom, in the offices, on the play yard. For us, we launch it every year with a community welcome to the school, where we invite all our schools, all our families to come. We serve them dinner, and we talk about attendance, and we welcome them to the school year. We do that about 2 weeks into the school year. Part of that messaging is, and it echoes what we heard earlier in the presentation, is it's really about having our kids understand that they have an important place in our school, and their presence matters, and we pay attention, and that means teachers notice, principals notice, and give it that attention it deserves. So it's really about fostering a culture of trust, respect, and engagement for our communities. And this is something that in our experience, has to be carried throughout the year. It's great to launch it. There's always a lot of momentum at the start of a school year, but the work really becomes when we're into the school year and other priorities start to take up our time. Making this a driving factor has been key. The other is collaborative team approach. We have found it's very important to have common structures in our schools. Site attendance review teams, site attendance review boards, in which teams work collaboratively to really support the needs of our students, particularly our chronically absent students. So each of our schools also have common basics, what I would call basics, and that's key staff. That includes parent liaisons, attendance clerk, nurse, or health technicians, of course, our teachers. All our schools have school counselors, at least one school counselor, and our administrators. And the key for us has been that when there is a need, we work together at the site and even at the district level when necessary. It really is about each of us understanding that key role that we play in supporting kids' participation in school, and then providing the resources and the means in some cases to come to school. And then finally, I think probably the most impactful and the one that we continue to improve is just to empower our teachers. We all know that parents, when there's a strong relationship between students and their teachers and their students and their families, teachers are one of the most trusted individuals in our schools. And so empowering our teachers to know that it's okay to be attuned and aware and take time to understand the needs of students, whether that's nutritional needs, health needs, of course, academic needs, and making those connections from the classroom to the support teams we have in place at the site and district level.
Thank you, Superintendent Zamora. It's such a powerful vision of how everyone in your community makes a difference, and how you've communicated that with everyone so they see themselves as part of the solution. We're going to go to Tiffany Anderson, Dr. Anderson. Tell us about Topeka.
Oh, we're so excited. Okay, so everybody on the screen, and let me look, 518 of you, you are ambassadors of hope. Okay, I'm going to talk about this from the lens of the social determinants of health. We have about 13,000 students, 76% are free lunch, and I don't want to read you this whole sheet, but I'm going to share with you some strategies you can use in addition to thinking about what our district looks like. And you may be very different, or you may be a policymaker or someone working in public health, but all of this should come together at the end of what I share. And I'll keep this as brief as I can, but it's some good stuff. Good, because we are proof that even with 76% poverty and 13,000 students, you can have a chronic absenteeism rate. We've had schools as low as 9% at our highest mobility schools, but you can have a chronic absenteeism rate that is aligned with the national average, which right now is too high, but 11%, 12%, and again, as low as 9%, even when you have a 53% mobility rate, which many of our schools do who have the highest poverty rates. So let me share a little bit with you, just a little snapshot before we go to this next slide, because I want to make sure that we spend our time on strategy. The first thing that's important to know, programs come and go. They come and go with the leader. They come and go with the budget. Systems remain. So let's spend our time talking about systems. Now, not punitive systems, but systems that heal. So if you're on the screen and saying, where do I start? Look at your systems. If they are systems that are punitive, then those are systems to re-examine and look at what are systems that heal. What systems can you put in place that heal? And I'll give you some examples of those. In our district, I do want to share, we have 37 languages spoken. In the comments, we're going to add 2 links. And so there's a staff member on that'll put the CBS link from the evening news about a month ago, the CBS link from the morning news. And what that's going to show you, if you get a chance to copy it and watch it later, both of those will show you how we have created a system around families that ensures that absenteeism goes down and attendance goes up. But we also have created a system to really address the social determinants of health and economic opportunity. Parents don't students don't choose to not show up, and parents don't choose to not send their students because they don't like school. There are underlying problems that really tend to exist. So in addition to those 37 languages spoken, that CBS video really leans into that equity and access. That's why I have the background that I have behind me. So let's go on to this very next screen. You know our enrollment, you know our free reduced lunch rate. Okay, so this item on the right, if you don't have this in place in your school district, please get it. When people want to know how do you give out resources, you can tell a whole lot about somebody based on how they spend their money. We spend our dollars based on the special needs index. It's something we created. So basically, let's take a look at Quincy. Quincy is our tiny school. It's our baby school. It's very close to the homeless shelter. So most of the families, many of the families that go there are families that have been or are currently homeless or living at the shelter. 164 students enrolled, 95% low income, 8% EL, 35% SPED. Take a look at that mobility rate, 63% mobility. So literally who's their student today will not be their student tomorrow. And so when you look at students, when you look at students across the board, the highest special needs index school is at the top, based on enrollment, low socioeconomic, ELL, SPED, and mobility. So we start with how do we look at data and how accessible is the data? We have put in place a system that allows, with one click of the button, the teacher, the parent, anyone in our community to look at the academic health history of a child. Chronic absenteeism, we can look at it every day, every week. We can look at the connection between chronic absenteeism with all the other social determinants of health, mental health services. But that special needs index helps us determine how we spend our dollars. So we invest our dollars based on the special needs index. Grants, when people come and give donations, when we're looking at a variety of other areas, we invest based on need. So when you think about equity and access, those words can get kind of confusing. What's equitable? Rather than in some districts, everybody gets the same thing. Of course, with title dollars, you can't do that, but with your general operating dollars, you can in some cases. And so that's one key piece for us as a strategy. Now let's move to the left of our screen. We, at one point, pre-COVID, had an 11% chronic absenteeism rate. Same free reduced lunch rate at the time. In 2016, we had 600 homeless students. We now have dropped that by 50% as well. We have a little bit over 200 homeless students, but all of these systems work together. And as you can see, as we reduce the homeless students, we increase the attendance, we decrease the chronic absenteeism. It all is connected. And let me give you some examples of that. As you look at the data, our goal in 2022, post-COVID, once we hit that 32% threshold of chronic absenteeism, our goal then was to reduce it by 50%. So you can see where we were in 2023, 2024, year to date. Right now, we're at 16%. And we still have the rest of the year ahead of us, but we are excited about what we can do. I see someone from Head Start that they're looking at it daily as well. Good for you, Melody. I'm telling you, that's really what you have to do. Look at that data regularly. So we do ask our leaders every week in their leadership team, pull up that system. If you don't have an electronic system, you need one. It should be shared across the schools. And with that system for us, we have 30 schools. We have these data consultations. So I, as the administrator, it's like a PLC from central office and a PLC for the principals and a PLC for teachers. So all of those pieces in terms of ensuring that we're all looking at data. All right, Building Parent Capacity. That's my book that came out in June by Corwin. We partner a lot with Visible Learning and John Hattie. He was just here not that long ago talking about teacher capacity, but let's talk about building parent capacity. Here's why it's important. If elementary students miss school, often it's not because they don't want to be here. It's because their parent didn't take them, couldn't take them. And so we have the rule that if you have 2 absences without parent contact, it warrants an immediate home visit. Why do schools wait for 5 days or 10 days? Because the truancy rules and laws say to do that? No, that's why they do that, but we don't have to wait 5 days, 10 days. 2 days without parent contact warrants a home visit. So we do home visits every week, and if they don't want us in our home, we do porch visits where we stand on the porch. And what we find out is that sometimes people have lost jobs. Sometimes someone has passed. Sometimes it's a food issues. At the beginning of the year, sometimes it's literally parents who weren't able to buy new school clothes. I mean, all those come into place. This is where social workers and all of these other pieces come into place. If you want to learn more about what we do for our parents, that Building Parent Capacity book that's out, it has flown off the shelf. That actually takes into account attendance as well. There's a whole section on attendance. And one of the things that it does, it breaks down the attendance numbers. So we actually give education to our parents, not only on those porch visits, but we invite them to our schools and we give education in terms of, do you know how many days it is when you have, and I'll give you just kind of one of those quotes, and it's from the book, 30 minutes a day is nearly half a day per week, 4 weeks per year, which is 1 year of school. If your child is out 30 minutes a day, if your child is out 2 days per month, we tell parents that's 20 days a year, that's 4 weeks per year, that's a year of school. So whether you're tardy or whether you were just out of school, all of those are areas that we educate our parents. So we build parent capacity around that. All right, here's the other piece, and I'll mention just as a really quick strategy, and so I can turn it back on over. I wasn't sure how much time I had, but I'm gonna talk as fast as I can so you get as much as you can. Here's a good thing though, we're allies. When this is over, I want you to go ahead and email me if there's some strategies that you need. Our team that's on, my staff member, they're going to put in there a link of wraparound services. Let me tell you what wraparound services are. Every city has a food bank, food banks that serve the homeless shelters and all of those spaces. We have placed across the community in multiple schools. So in every end of the community, there is a mobile food pantry. So parents can shop with dignity. So food is in the way, they shop in those areas. We put 18 washer and dryers in our schools. You can wash one load for free for 1 hour of volunteerism. We got parents in schools all the time. If they weren't going to take their school and they got dirty laundry, they're going to bring their child to school. I mean, so that's wraparound services. We increased our mental health team. So every school has a mental health team, school site counselor, social worker. And those are some of the people that wrap services around. On our website, you will see there are 3 questions we ask every parent. When they enroll a child, those 3 questions are from the AAC survey. If they say yes to all 3, immediate home visit. It has changed absenteeism. I mean, those are just some of the strategies. So we basically remove barriers. That's that third one down from coming to school. Creative ways that we do that are some of the items that I've already talked about in terms of wraparound services. Last item is transportation. Some people will say it's transportation. Maybe they don't qualify for a bus. Maybe they're just too close. And so we have address that as well. We actually built it in our budget. We put about $250,000 in for a family bus pass. So families can actually utilize that. And we have some other creative transportations. And the last item, which you said earlier, Heidi, was to make schools a place you want to be. Look, this year I am teaching 8th grade for a semester. Woo. In fact, I was teaching this morning, y'all. And I am learning so much about what gets in the way. How do we walk alongside our families? And so the closer you can listen to learn, which we have listening tours here in this district, the more that you can remove barriers. You see, y'all, we can't serve needs we don't know. So get to know those needs, you'll find the barriers, then remove those barriers, simply put. I'm gonna turn it back on over to you, Heidi.
Thank you, Dr. Anderson. I wish I was in your 8th grade class. All right. Now, Dr. Chapman, please join us for Columbus. And you, I do, again, want to acknowledge you have a huge district in an urban area. And so you're really having to think about how do you create a system that serves at scale. Can we go to the next slide? Tell us
Yes,
about Columbus.
good afternoon, everyone. It's a pleasure to be here with you talking about this very important work. And yes, Dr. Anderson, I want to sign up for your 8th grade class, so I'll send you an email about that. I have the privilege and pleasure to lead CCS, Columbus City Schools. It's one of the largest, it is the only large district in the state of Ohio. We have close to 45,000 students, 114 schools, and over 8,000 staff members. Our school district is home to a vibrant and diverse student population. We have over 45,000 students, and those students represent 104 countries and speak 95 different languages. We certainly consider our diversity as one of our district's greatest assets, bringing many cultural experiences and perspectives into our classrooms. And as Hetty mentioned before, when we think about the work around attendance, at the height of the pandemic, we had a chronic absenteeism rate of 75%. That means 75% of our students were missing 10 or more days out of the school year. Next slide, please.
And I also just going to comment, unfortunately, Dr. Chapman, you were not the only urban area that was experiencing those extraordinarily high levels.
Yep, we were definitely hurting. When we think about chronic absenteeism, mostly it was our Black and Brown community. This slide shows that, you know, our Black students, Hispanic students, multiracial students, they were experiencing the highest rates of chronic absenteeism. Next slide. So this data really caused us to think differently about how we were thinking about attendance, how we were tracking attendance, and that started at the system level. So when we think about chronic absenteeism being a focal point for us, we certainly considered all of the mental health challenges, as Dr. Anderson said, the social determinants of health, and thought about what can we do differently to respond to this level, to this challenge at the district level. Last year, we implemented a multi-tiered approach to address these issues and saw meaningful reductions in chronic absenteeism, specifically through partnerships with local organizations, enhanced data tracking, making sure that everyone has the data at their fingertips. They have the data in real time. School-based staff can pull those reports. They don't have to send an email or go track it down from somewhere else. And embedding those attendance goals into the school improvement plans. So we have said, and under my leadership, before I was supervising the school-based teams, and now I'm over the whole district, I've always said, whatever it is that we're prioritizing, we have to measure that, and it has to be baked into our goals. And so attendance is a strategy that I'm talking about at the board table as a superintendent. It's a strategy that every school team is talking about, and it's aligned to their school improvement plans and goals. Because of that alignment and a laser-like focus on this strategy, we have seen a significant reduction in chronic absenteeism. And we've also worked diligently to connect our students and families to the resources that they need. Again, our goal for the next year is to reduce chronic absenteeism by 10%. We have already decreased chronic absenteeism in CCS by 20%. Again, at the height of the pandemic, it was at 75% chronic absenteeism, and now we're at 54%. We need to continue to make progress, but there's still a long way to go. Next slide, please. So when we think about our team structure, we have certainly said that this work has to live in our schools, and everyone who's working with our students need to be at the table so that they can identify who are these students that need these home visits, who are the students that we need to connect with resources, who are the students and families that we need to see them, we need to know who they are, and we need to know them by name. And so we have, again, made sure that we have in every school, we have the resources and supports for our school leaders and staff to do this by investing in social workers, school counselors. We also have social emotional learning practitioners who are providing resources to our staff so that they can implement SEL in the classroom. We have PBIS coordinators, again, that are supporting our staff with doing this very important work. We're a district that is we're focusing on restorative practices. So we're thinking about the whole child, not just thinking about the child as a number and the number of days that they're missed. And again, we have attendance support specialists that can work directly with the family. So these are significant investments that we made district-wide to make sure that these positions are available, and we have the expertise of the staff available in each and every one of our schools to provide that robust support to our students, our families, and support the staff. So this is the structure. Next slide, please. And when we think about our PBIS, so most of the districts, all of the districts in Ohio have to have a positive behavior intervention support system. They have PBIS teams. And so we've integrated our attendance work in our PBIS team. The team is already coming together to discuss academics, to discuss behavior, to discuss any other challenges that the students may have. They need to be discussing attendance and chronic absenteeism. By embedding attendance within our PBIS teams, we've created a school-wide structure that uses real-time data that they have at their fingertips to identify at-risk students and intervene early. The early intervention is key. In the first month of school, which we're still in the first month of school, you can already predict which students are going to be on track to be chronically absent this year. And so we began that work in the summer. So we looked at the data from the year before and said, who were the students that were chronically absent? Our team was reaching out to families over the summer and saying, we have to reverse this trend for the next school year. What do we need to do to make sure that you're in school on the first day of school and your students stay engaged? Again, continuing to empower these school-based decisions and empower the team and have the resources they need to be successful. Next slide, please. And certainly we do not do this work alone. We have relied on several community partnerships to help accelerate and elevate this work. We've partnered with the Columbus Rotary, Columbus Public Health Department, the Columbus Clippers, and the Columbus Crew to support the attendance awareness campaign. They provide incentives and supports to help this culture, this proactive culture about knowing why it's important to attend school and providing incentives to students and families who are attending school regularly. We're continuing with our family outreach and engagement. Dr. Anderson talked a lot about home visits and the outreach and making sure that you're reaching out to families. That is certainly embedded and baked into our processes here in CCS as well. So thank you. Hetty, we can't hear you.
Classic, huh? Thank you so much, Dr. Chapman. Such helpful to see this systemic approach that you are addressing. I want to ask, I'm going to do a quick question for Dr. Anderson. Someone asked in your little graphs, what was SNI? Can you tell me what SNI is in that table?
That's a special needs index. So that's how you know who's first and who's last on that list. But the factors for the special needs index were the items that came before it.
Okay, great. I just wanted to do that because that seemed like a quick question. Now I'm going to ask you a bigger question. My question, if we go to the next slide, is in your position as superintendent, what are you learning about what does it really take? What are the lessons learned for fostering a culture of attendance and engagement, making this a pervasive part of your culture? What would you say are your one or two top lessons learned about how to do this? Andres, might you start us off?
Absolutely. I think our biggest lesson has been taking a couple of things, and we heard a lot about it already this morning. Taking a systemic approach to what we do, ensuring that we understand the needs of our students, our families, and our schools, and meeting those needs where they're at. And that looks different at each of the schools. That one, but I would say that the highest leverage, I think the one where we as a district invest a lot, and that is in the people who do the work. Programs are only as good as the people who implement them. And so for us, relationships and people are the factor that make the real difference. So how we develop and support the folks that do the work, that are part of these teams, to do it well and do it effectively, and to also focus on those relationships has been the key factor for us. So we always say it's people, not programs, that makes the real difference. And I would say the lesson learned is that, especially following the pandemic, is that the punitive approach doesn't work. If kids aren't coming to school, it's our responsibility to figure out how we can support them, help them, get them here. I saw a question earlier today that said, well, how do you deal with kids who aren't coming to school because they're sick? Well, we'll send a nurse to their home, or bring your child. We'll check your child, and we'll connect you with a doctor in our community, because we have partnership with our local clinics. So it's creating those relationships, removing those barriers. A lot of what we heard this morning have been the things that were true pre-pandemic, post-pandemic, and continue to be the work ahead for us.
Thank you. Dr. Anderson, do you have any other lessons? We can build on each other, but I also want to ask you to, so in terms of just lessons learned about creating that culture of attendance, is there one? And then I want you to also talk about the kind of public health, the health provider, because people are asking these questions, partnerships that you've created. But
no, absolutely. First of all, Michelle, I think you asked something about what do I do when a parent says my child doesn't want to come to school? Have mercy. I think we've all heard this. No matter where you are leading or teaching at, it's why I wrote the book, Building Parent Capacity, because we have to build the parent's capacity. Ask that parent, do you want your child at school? That's first question. If they don't want to be here, and then the why don't they want to be here? It could be I miss being at home. It could be it's not fun, it's not exciting, it's not engaging. All of those may be real things that are occurring. And so getting that parent to partner. Michelle, I was just trying to type you that, but it's quicker for me to say it. So this piece about health and public health and the big chunks of the big rocks, I guess, so to speak, a couple of the big rocks, and it was somewhat mentioned in this space, but systems. Okay, every time you think about the systems will reproduce anything it was designed to reproduce. If it was designed to reproduce generational poverty, institutionalized racism, it will continue to produce it long after you're gone. So here's the thing, disrupt the current system and embed a new system, which includes adding in the social determinants of health. Economics is one. So we employ about 10 to 20% of our staff are our parents. They will get their children to school. They will drive buses to make sure children come to school. They will talk to the other people in the neighborhood to say why they need to be at school. They become our advocates. They become our allies. I've learned through my research that there are 4 levels that parents fall in. And in most schools, they fall in the listening level of just coming in and being participants. And we need them to be leaders. And so those 4 levels, that's part of what I kind of go into in terms of building parent capacity. So that's one big chunk in terms of that. The social determinants of health and public health, we actually, both in my last district in Missouri and in this district, so Missouri, baby district, this district, a little bit larger, we partnered with the health facility. If you don't have a health facility as a partner, please go get one. So when I started in 2016, I just started cold calling hospitals, just like I did in St. Louis, saying, will you build a hospital in our high school? I know sounds crazy, but you'd be surprised. University of Kansas has a hospital at Topeka High. You break an arm, that's okay. Come on to school, we got it. Same in St. Louis. Washington University Medical School is the partner there. full-time pediatrician, parents can get their full healthcare access. Put the areas that parents need in the community, schools are the center of the community, put that in the school. Just like I mentioned, the washer and dryers. If you put public health and those health resources in the school, you've done two things. You've closed the disparity gap within the community in terms of health access and equity, but you've also ensured that parents will come to school to get their services. That's serving the whole family. That child has to go home to that parent. So you're building parent capacity at the same time of serving the whole family. That's at least one example of what that looks like in terms of just basic partnerships.
Thank you so much. Dr. Chapman.
Yes.
So what would you add to what allowed you to create this culture of an engagement? And then I want to actually also turn to asking you about community partnerships, because you started talking about a number of partnerships you have, and I wanted to find out your tips for how you enlist those partnerships. But first, anything you'd add to what it takes to create that culture of engagement and attendance at schools?
Yes, so I certainly would like to echo my colleagues that mentioned relationships are foundational to this work. We can't do anything without relationships with our students, our staff, and our families. We have certainly empowering our school teams to make sure that they have the data that they need so that they can have these conversations. But what I want to name is that for me, the lessons that I learned is that this work starts at the top. It starts with the superintendent saying that this is a priority, and we're going to organize our resources, our time, our conversations, how we talk about supports around this need of closing this gap. And so we have set that as a priority at the district level, and everyone knows when it's a priority, that means we're talking about it at the board table. We're talking about it in our district leadership team meeting. We're talking about it at our school-based teams. Everyone is having similar conversations about addressing that need. And then thinking about partnerships, I would say that you have to figure out what it is that you need to keep our students engaged once they get to school, right? And so we have, again, partnered with a variety of different partners. We have a partnership with Nationwide Children's Health. We said during the pandemic, we're not the health experts. We need support. And so we have a medical doctor, a pediatrician that's on loan from the Nationwide Children's Health, and they're part of my cabinet. And so she spends 2 days a week in all of our meetings and on campus with us, advising us on our strategies, whether it's attendance, whether it's athletics, it doesn't matter. We have a resident expert on board, again, helping us close that gap. So maybe it's an information gap, maybe it's a leadership gap, maybe it is resources that you're trying to close. We talked about attendance and getting that attendance campaign. We needed help with making sure that our entire community understood the importance of this challenge, and we needed help with that. Perhaps that, the parents weren't looking at our messages, perhaps they would pay attention to the message if it came from a local partner. And so we extended our reach by asking our partners to help relay messages for us. And so we're still trying to connect those dots so that becomes just a part of every conversation that we're having in the community, whether it's in the pulpit, on Sundays at church, or if it's a press conference that the mayor is having, at an athletic game at the Crew Stadium or the hockey game, they're going to hear the message, why attendance matters and why we need every student in school every day.
That is so helpful. I'm kind of going in between questions in the chat or in the Q&A, as well as some of the questions we've had for you. Dr. Anderson, I think this is to you, but if anyone else has strategies for this is about kids who are homeless. What are effective strategies for really addressing the needs of homeless kids? Are there particular partners you need? And what have you found that's worked?
Oh, collective capacity is everything, y'all. I put in the chat there an Al Jazeera video. It's an international video from years ago in Missouri. That tells you really how the social determinants of health looks in action. Dr. Chapman, I love your statement about relationships because basically, people will work with you and for you if they trust you. They won't if they don't. That includes partners. So we actually connect with our partners about the economic prosperity in the community based on their ability and willingness to partner. So because some people may not necessarily see how their influence can matter. And that includes our homeless families. So we actually looked at and looked for, this is the power in telling the stories, everybody on this screen. We looked for places that had decreased homelessness by 50%. There was a place not that far from us called Wyandotte. We replicated what they did. We call them impact days. We have an impact day. I have my homeless coordinator who takes in referrals for people who are homeless. They go to one site on impact days, on those impact Thursdays. Every social service in this community comes together. So the service that would normally take you 6 to 8 weeks or longer to get, they're all in this one location, including landlords who have signed on. We've had a 95% success rate of individuals who come in homeless. They leave literally with the key in a home. It's pretty remarkable. In fact, our team will put an article on Impact Avenues. In fact, there was an article on a homeless parent who actually lived at the shelter, who now works for us, again, social determinants of health, that 10%, 10 to 20% of families we employ. They'll put that article in here because we have a PDF of that. That was in the front page, I think, last week. But that has allowed for parents overnight to move out of homelessness. You would think that's not possible. That's one example. So if you have other partners in the community, bring them together, see if you can get the city to be the backbone, even if you can't, if they're willing to give services. Let me give you another really quick example, and I know we're kind of short on time, but one quick example in Missouri. It's the only place that has a homeless shelter for students. If you look up the Washington Post, type in Hope House, my name, you'll see it. We decided to open up a shelter for students. And they said, we can't do that. Well, why not? Do we have any dilapidated buildings? Hey, y'all, do y'all have any buildings that are falling apart that you could renovate and with the right partner, turn it into a shelter for children? We looked for a partner. The Missouri Baptist Foster Home is our partner. We asked them, do you have any families that want a free mortgage or no mortgage? A home that has maintenance by the school district, and all we need is a foster home, and y'all take the liability. They said yes. Hope House was born. I just literally stopped, bought a sign, called it Hope House. They now have a second Hope House in St. Louis. It's really great in that same district. So those are just examples. I could go on, but our team's going to put a little magazine article link, and those have lots of articles, national, international, and local. Hopefully that gives you a few examples.
Thank you. I'm going to switch around to a different question. How do you all work with your board members? How do you all work with them so that they're supporting this issue? And have you ever had to deal with any dissent?
Well, I haven't had dissent in Topeka. I'm going to turn it on over to everybody else. I'm the first Black.
How have you been able to make sure they're supportive? But
you know what? And I'll turn it over to the rest of the team. But in my space, listening to learn. So constantly educating board members. One of my board members was in my class today, inviting them to the classroom, inviting them to the parent conversations. That allows them to learn so that this is collective support. I'll turn it over to Dr. Zamore. I think you're about to say something. So
no, thank you. I think one of our responsibilities as superintendent is to educate our board. And we do that by not only providing information at the board during board meetings, but also, as Dr. Anderson said, bringing them to the schools, bringing them to where the work is happening. And improvement is not free. So part of the work of both the superintendent and the board is to allocate the resources. And that happens when we have an informed board that understands that, yeah, we're gonna spend a lot of money to provide counselors, to provide parent liaisons, to support our health services. But it's for an impact on the kids that need it most in most cases.
I would echo those comments. We haven't received any dissension from our board about supporting this strategy. They always ask, how can we be better allies? How can we help promote this message and support the attendance awareness campaign? And like all of our other board goals, this is a goal that we're tracking in Columbus City Schools. So we're having these conversations, updating them on our progress at the board table. And they always ask us, what other resources do you need to help close the gap to meet this goal? In addition, many of our board members are also parents. in the district, right? Like myself, I have a student in the district. And so we recognize it may not be our own child that's having these challenges, but it may be, our children's peers that are having challenges and are not as engaged and not attending school. And so we also have that personal perspective that we can bring and add to this important conversation.
This is work that needs to happen over time and get sustained over time. As a superintendent, how do you make sure that that sustainability is built in? What have you found to ensure you can sustain the work over time?
So I'll start with this question first, because when we, at the height of the pandemic, when we were seeing all of the challenges with chronic absenteeism, we did not have a system in place at all. No one was talking about attendance. At the time, our attendance rate district-wide was probably at 80%. We didn't know that there were students who were like over half of our population, more than half, was not coming to school regularly. We didn't know that until we started to dig into the data. But I would say certainly, again, making this work as a part of our board goals and guardrails, ensuring that this work is a part of our strategic plan. We are baking it into the system to say, this isn't work that we can do overnight. We need a long runway to have a lasting impact. And so while we've made significant progress thus far, the work continues. So we need to build capacity internally and externally to make sure that everyone understands why this work is so very important. So for me, it's about building the capacity, right? With funding cuts, we may have a team member that may no longer be in a specific role, but they may be in another role. So if we're building the capacity of everyone, then everyone can help us carry the water, carry the weight, even if their roles change in the organization. And so it's about building capacity so that we can have sustainable change and improvement over time.
And Dr. Chapman, I do remember, since I think we were around in those early days, that one of the challenges, there wasn't a clear designated team that had cross-departmental responsibility that held attendance. It was everywhere. And then it meant it was nowhere. And so I do hear you both identifying where it exists, how it exists, and then baking that into all of your plans. That has been such an important improvement over time.
Yes, and if I could just give a shameless plug to Attendance Works for helping us get to this place where we have a district-wide strategy. We could not have done it without them. And so I just truly want to say thank you to them. And if districts for the system level are thinking about how to make sure that the system is prepared to respond and thinking about how they organize those resources, Attendance Works is an invaluable partner in helping us to think that through.
Well, it works because you got the champions inside who then make sure it happens. Right back at you. Superintendent Zamora, I want to just go to you for a second, because I've also known that you've tried to sustain this over. And in the conversations with your district, some of it has been about how you're strategic about what you take on and don't take on, so you can actually keep up the work. Can you talk a little bit about that?
Absolutely. In California, we have the local control accountability plan, which is our strategic plan. And part of that plan has within it, we've developed structures within it that actually engages our ed partners at all levels. And that means engaging our student groups at all schools, engaging our parents, engaging our community partners, our administrators, in dialogue around our data, dialogue around our priorities, whether it's academic, in this case, attendance. And in the end, we take what we learn from our partners to synthesize and then set our priorities. Those priorities are then what we fund. So for us, sustainability is built around that, is using that mechanism within that requirement of local control to really leverage the opportunity to listen to our ed partners, to educate our ed partners, and help us set our priorities that really meet the needs of what we're hearing from our school community.
Thank you. Dr. Anderson, what would you add to this?
You know, I think it's all really been said. Dr. Chapman's comment about attendance works is valuable in part because you focus on systems. And I added that into this comment of, as opposed to working for someone or doing the work for them, you work alongside. So I capped the alongside. So making sure that you have partners that are going to be able to help sustain, because grants are going to go away. Grants will go, and again, funding will change. That capacity building space is important. One thing I do want to mention that hasn't come up yet, your legislative resource is critical to this work. Our governor had a CREJ, a Commission for Racial Equity and Justice. I co-chaired it with someone else as her appointee, and that work has concluded, but it was focused on the social determinants of health. We put in things like childcare tax credits. We put in things that get in the way from parents being available to take their child to school. And so that legislative arm, now, as of last year, we put in place our parent advisory group. They actually have a legislative advocacy, and they talk about attendance, and they are the ones going to the Capitol, which is right out my window because we're in Topeka, Kansas. I mean, so if you are building capacity, between part of that, I share a lot of that in that book, Building Parent Capacity, but student capacity, teacher capacity, all of those, including a student legislative group. They go to the hearings, they talk about attendance, they know. I mean, so for us, the systems we put in place, it allowed us to remove and reduce even suicide rates for 6 consecutive years once we put those 3 questions down. So students can talk about attendance, students can talk about mental health. That's powerful. So that legislative arm, hold folks accountable. State reps and senators, hold them accountable. You elected them to be in office so they can work a lot. Even funding attendance works. They can work alongside other places that are trying to do the work.
You know, I also have a question for you guys as superintendents. Do you feel folks in your communities understand the connection between attendance and curriculum and instruction? And have you had to do anything as a superintendent to help make sure people understand those connections?
Okay, now y'all know I'm a daughter of 2 pastors, so for real, I will talk. So I was trying to wait for Dr. Chapman and Dr. Zamora. Having said that, since I was just newly ordained, I'll just jump on in and just start talking. Very quickly, in terms of that, everyone doesn't understand. Even some parents don't understand. That's why we have parents as teachers and a lot of other systems. If you don't have children in school, you may not understand. If you are someone, Kansas, we're a red state. We're very conservative here in Kansas. And so, you don't always, understand the connection between coming to school, especially with virtual education. Why do they have to be there? And so it's up to us to continuously make that connection. And we make it based on looking at crime rates. We make it based on the economic prosperity rates. We make the clear connection and make that data very transparent about, students who come to school here, not only just the academic test scores, but the employability rates, all of those. So not everybody does understand, but that's why we're here. That's why we're here as educators. Every last one of you, whether you're a teacher, principal, or superintendent, you're a blessing and a lesson every day. So you can teach and educate along the way.
Yeah, I would agree, Dr. Anderson. I don't know that they understand that connect specifically, but I do know that they understand whether their child, regardless of the home circumstance, whether their child wants to get up and go to school or not. And if they're excited about going to school for their teacher, for what's going to happen at school in the classroom or out, parents understand that. And I think for us, that's where we get the leverage of parent support, regardless of the circumstances that may be at home that may be difficult. If their kids jump out of bed and want to come to school, they understand that.
Thank you. I also want to offer up to Derek, who I know has been sitting here and listening. If there are any, what are you seeing as the connections between what these superintendents are saying and what you all have been finding from the research at the Ad Council?
Yeah, it definitely is reinforcing the partnership that exists between schools and parents, right? And I think that's really important to understand, as communication talks about opportunity, which we discussed, is also, if that trust and establishment and relationship and partnership exists, talking about opportunity is much easier. So I think the two go hand in hand to reinforce one another.
Thank you. I also want to ask another question about pushback. There's a question of do you ever face pressure to take a more punitive approach with families whose children have poor attendance and are seen as resistant to support? And how do you deal with that pressure to take a more punitive approach?
I would say absolutely. Yes, yes, and yes. In the state of Ohio, our state, the Ohio Department of Education, the legislature, they continue to approach this work in a punitive way. And so it requires us to report families to the courts, if they're truant. And we know that that's not going to change behavior. We know that that's not going to interrupt the challenges, the barriers that our families are experiencing. That's why this work is so important. So we are doing this work in addition to, on top of, and in spite of all of the paperwork that we have to do and the punitive, sending the letters and reporting families to truancy. We are doing all of this work to really circumvent that work. And so as a part of the conversations that we've been having with the Ohio Department of Education, is we're trying to push on them, to push on their legislatures and policymakers for them to be taking a proactive approach as well and to join us in this effort. The pendulum has shifted. We know that, you're not going to put parents in jail because their kids are not going to school, and that's not going to solve anything. But that was the old mentality and mindset that we were going to, drag parents down to the courthouse and the judge would somehow, issue some, draconian consequence. That's not happening, right? And so we have to be thinking about how we offset some of that and how we take ownership of this work. This work is based on relationships. It's not going to be solved. It's not going to be addressed in the courts. It's not going to be addressed at the courthouse. And it's not going to be addressed through punitive legislation.
Appreciate that. And there are some comments in this about even getting the juvenile courts on your side, because when they get overwhelmed by thousands of cases that they don't think they should have and they can't address, sometimes they can be allies in saying that approach doesn't work. Kwesi, you've been listening in. You have tons of thoughts, reactions, questions you think that we should be considering as we've been hearing this incredibly robust discussion among our panelists.
Well, I do want to, and again, thank all of the panelists. Obviously you started this thing out by saying there's no silver bullets, and I can't speak about other countries, but certainly here we tend to want to have a silver bullet. There are no silver bullets, but there are systems. And one of the most powerful things I heard was programs come and go, systems remain. I'll be stealing that. It's ours now. But it's a reminder, and for folks who are listening, who aren't superintendents and don't have the ability to just make a call on something, send this video to your superintendent. I mean, I think it takes all of us to do what we can within our role, and you may not have the ability or the influence to just make all those changes. But what we've heard today is that leadership matters, that creativity matters, that getting to the root causes matter. Creativity like volunteer hours for access to washing machines and dryers. I mean, that's something that simple. And not all school districts have had the political will to go that far. And this is where educating your board, we heard about the importance of building capacity and educating internally and externally. And so all of us could play a role with that. And so I'm just so happy to hear. And then we heard obviously that there's just so many great results that come as a result of it. And then Derek, thanks also, because the message matters. And we do need to make the case for the importance of being in school, but we also need to make it in a way that is inviting and not blaming the victim. Again, going back to root causes. So we've got to investigate. We heard a lot about investigating. We heard a lot about finding out reasons why instead of making assumptions. These are
Kwesi, I was going to just say one thing I worry about too is that when we take a blaming approach, I actually think we increase the distrust between parents and schools, even among not just low-income and chronically absent kids, but I've seen middle-class parents who, when they get a blaming note, your kid missed school and they think it's unfair, it makes them think schools don't understand us and don't care about us. And when we don't start with engagement, I think we actually put the system, our public school system, at risk, because we risk alienating the people whose support we need to sustain it.
Yeah, I think that's right. So again, thanks to everyone. I know we're getting close to time. Pele, you may want to put the slides back up. As we wind down, check out the Attendance Awareness Month proclamations webpage. Hetty, are you going to talk at all about the campaign, the 50 and 5?
We did that earlier, so I think these are just.
So we're good. So get your state to sign up. And if you're not a superintendent, send your superintendent a copy of this webinar and say, hey, we heard some great things going on in these other places. We ought to think about doing that. Next slide. Download our free social media materials, etc. Yes, you will get access to this webinar and all the resources that we talked about. Promote the campaign. Please sign up and be an active member on this important issue. Next slide. We've got a new toolkit, what to do when at a glance, an easy on-ramp for developing and expanding a local and statewide attendance awareness campaign. Join the campaign if you're is one of the states that has already signed up. Find out what that means. There's lots of tips, lots of templates. This is why supporting attendance work is so important. Next slide. Like us on Facebook, Instagram. I don't think we have a TikTok presence, but maybe that's coming. Add a badge to your signature line. Follow us on LinkedIn. Stay connected, because the connections help all across the board. Next slide. Yes, we will post this webinar. That's always the first question. Yes. Yes, yes, yes. All of the webinars will be available. Let us know how we did on this webinar as well as the others in the series. You have a link and you'll receive that link as well when you get the link to the video. Thank you, thank you, thank you. Thanks again to our partners, Heising Simons Overdeck, individual donors, our philanthropic partners. Thanks for sure. Last slide. That was it. Last word. We ended with 2 minutes early. There's 2 more minutes that you can use to build those systems and not those programs, according to Dr. Anderson. Thanks again so much to Derek and our superintendents for taking the time and sharing your lessons with us, because there's so much to learn. And we'll be in touch for sure. Last word, Hetty?
Just a deep, heartfelt thank you to all of our superintendents here one more time. You are heroes who help me see what's possible in what you do every day and over time. And I also want to do a special shout out and thank you to the audience. This work builds up from local champions. And we have make a difference when all of us are moving this work together, each in our own way, tailoring the strategies to what we know our kids and families need. So thank you, everyone out there, for all the work you're doing every day and all the work you will do throughout this school year to make sure kids are in class every day possible. Thank you.
And thanks to Pele, Giselle, and the rest of the attendance work staff, and to our fearless leader, Hetty Chang. Take care, folks.
Thank you.